Thank you all so much for joining. My name is Brooke Gentry, and I'm the AOT Implementation Coordinator at Treatment Advocacy Center. I'm so excited to unveil the new and improved AOT section of TAC's website. And I'm even more excited to take you on a deep dive into the brand new AOT portal. Registration for this webinar was made possible to those in our free AOT Learning Network. If you were forwarded the registration link, we would strongly encourage you to join the AOT Learning Network. You'll learn the new way to join today via the AOT portal. And given that this is a website demo, the webinar will be a little shorter than our regular educational webinars and will likely not take the full hour. Please feel welcome to submit questions throughout the presentation using the chat and the Q&A feature, and all questions will be addressed after the presentation. So let's go ahead and get started. I'm going to share my screen. Okay. So this presentation will mainly focus on covering two different areas of the TAC site. First is the AOT pages on Treatment Advocacy Center's regular website, which are available without logging in. And then second is the AOT portal, which is a free online membership platform for the AOT Learning Network. So this table of contents just kind of has what we're going to cover today. So we'll keep moving forward. And the AOT web pages of Treatment Advocacy Center's website are all accessible to the public without logging in anywhere. These pages are designed to be an all-purpose resource for everyone interested in AOT, regardless of their level of involvement or engagement. I'm going to go ahead and take us to the AOT homepage. This is the AOT homepage. This direct link, treatmentadvocacycenter.org/AOT, will get you here. You also can just go to the regular TAC homepage, which is treatmentadvocacycenter.org, and click the AOT button in the top toolbar to navigate to the AOT homepage. The AOT homepage itself will help you get to deeper levels of content on AOT dependent on your needs. And to get to this page, like I said, you click the AOT button in the top toolbar here. You also can hover over that, the purple AOT button right here. When you begin scrolling, the first thing you're going to see is a handy definition of assisted outpatient treatment. By clicking Learn More, you'll be taken to the What is AOT subpage, which you also can get to by hovering over AOT at the top here and then clicking What is AOT. So this subpage has another definition of assisted outpatient treatment that builds on the definition that was on the homepage. It's slightly longer, and then it defines what an AOT program is, as well as covers the essential elements of an AOT program. You might recognize these essential elements from our white paper and our learning modules. We're going to return to the AOT homepage and keep going. The next section, Every Community Needs an AOT Program, explains in more detail how assisted outpatient treatment is a legal procedure, but requires an organized collaborative effort between the court and treatment system to be effective. And then the link right here takes you to our white paper, a PDF of that. And Treatment Advocacy Center's white paper on AOT is the most important foundational document that we offer. And it also is a detailed informational starting point for those looking to implement AOT in their own communities. The white paper offers guidance on the establishment and operation of formal AOT programs at the local level, and also covers the building blocks of building a sustainable AOT program, as well as tips for maximizing results in your existing program. Next on the homepage here is a section linking to the AOT program locator. You follow this link to a page that includes a PDF document of AOT programs and their contact information organized by state. You could see that here. Like I said, right now the list is a downloadable PDF. If you scroll down, you can click download. And we are working on developing a clickable map for even more ease locating programs in your area. So at some point, this is going to be a clickable map, but right now it's this list. If you notice any programs missing from this list or any contact information that needs to be updated, we would greatly appreciate you shooting us an email to aot@treatmentadvocacycenter.org so we can add any programs as well as edit the contact information for existing programs. And then if we go back to the home page again, underneath that program locator link are frequently asked questions on AOT. These are the 5 most common questions we get and the things you most fundamentally need to know to have an understanding of what AOT is, who it's for, what it accomplishes, how to get someone into a program, and how these court orders are enforced, and then how do we pay for this. And so you can click into each FAQ and get more information there. And then I'm going to skip this next section for a second and move to the bottom of the page where we have 2 links. These links basically take you to the same place. Our AOT resource library is now located within the AOT Learning Network portal. So both of these buttons will take you to the login page. And like I said, the resource library is in the portal, so it doesn't matter which of these you click, you will go to the same place where you will log in or register. And then back to this drop down on AOT, a few other pages that I'm not going to spend too much time on. One is the Contact Us page. This is a form that you would fill out to contact our AOT implementation team, which is myself, Amy, and Betsy. And those inquiries go directly to our email inbox. So if you want to kind of skip filling out the form, you can also email aot@treatmentadvocacycenter.org and reach us that way as well. And we're more than happy to talk to anyone about anything related to AOT, whether you need resources, you're focused on a specific case or a loved one that you are trying to get into a program, whatever you need, we are happy to talk to you. And then back to the home page, this section here. These 3 pages are designed to function as an educational tool for multiple audiences. So those who are at the very beginning of trying to understand what AOT is and whether it can be helpful to a loved one or whether or not you have it in your community, and if not, what steps should be taken to get it in your community. That would be here all the way up to folks who are working in a professional capacity in AOT programs as clinical providers, judges, and other roles who are looking for basic information and resources that they can use on a day-to-day basis to implement. And since obviously those audiences have different needs, that's why we've organized the pages like this. I'm going to start with the Mobilize Support in AOT page. And this page is designed for AOT champions. By AOT champions, we mean anyone who's come to understand the need for AOT in their community, and they don't have it currently, excuse me, and they want to advocate for it and bring together all the stakeholders to get to a point where the community says yes and supports those efforts. So the page itself walks AOT champions through the first steps of getting stakeholder buy-in. We have a link to join the learning network, a link to contact us so that we can help you in your efforts. And then also these drop downs on how to identify your key stakeholders, convene a meeting, engage the media. These are all the first steps you would take to start AOT in your community. And then kind of the next audience or step after you've mobilized support would be to actually start the program. So you have support. How do you actually launch a program? And this page is designed for implementers, which is just the word we're using to describe those who have already done that groundwork to get consensus in their communities. And they have all the people around the table who are needed to make AOT work. And so the page includes 10 building blocks for establishing a new AOT program. And it also has this link here back to the program map locator. So you can make sure that a program isn't already available in your community. And again, once you have that buy-in from your stakeholders, you have the momentum, this would be the steps you would take to actually start a program. And if you click into each of these drop downs, you can find more information for what, for example, oversight of participants would look like. And then the third section, the maximize results in AOT page, is for people who do have their program up and running already, but they feel like maybe it could be better, or they're concerned about whether it's going to be sustainable. And they want to learn how to do AOT in the best possible way, maybe connect with others who are in the same boat, or maybe connect with those in a more advanced stage from whom they could learn. And that's why we have another plug for the AOT Learning Network here, because the portal has a new feature which will allow you to connect with other AOT Learning Network members who may be operating programs themselves, so that you can learn from each other and all benefit from that shared knowledge. And then the page has these tips for maximizing results, which, like the other drop downs, you can click into each one and read more. Okay, so just to summarize thus far, I've covered the AOT pages of TAC's website, which offer guidance for gaining support for AOT, establishing a program, maximizing results. We've also touched on additional AOT homepage features like that program locator map, FAQs, and definitions of AOT. And another reminder, you can always contact our team via email at aot@treatmentadvocacycenter.org. In terms of the program locator map page, if you know of a program that's doing AOT that is not on our list, please reach out because we would love to know about it. And then before we do a dive into the portal and what that is, I wanted to provide links to a few other pages on TAC's website that you might be interested in. You'll find direct links to these pages in the PowerPoint here, and you can also navigate to them using the top navigation bar on the TAC homepage. We're going to start with the Joan C. Scott Family Resource Center. And again, to get to this from the TAC homepage, you would go to the resources and research section, and then under family resources, you would click Joan C. Scott Family Resource Center. So the Family Resource Center is your go-to for information, resources, or support for someone impacted by severe mental illness. And this page also has information on how to contact the helpline team for individualized support for individuals living with SMI and their caregivers. So you would click this Talk to Someone button, and that's how you would contact the helpline team. And then the Look Up Your State page is another one under that resources and research dropdown. This is the SMI resource map where you can click your state to find state-specific information, ranging from family resources for navigating your particular state's SMI treatment system to specific treatment laws in that state. So just as an example, I'll click Texas. You can see that we've given Texas a grade based on their SMI treatment laws and policies. And then you could see there are multiple sections in here. You've got family resources, you've got kind of by the numbers, more information about hospital beds, and also some fast facts. So if you're just interested, or if you're looking for more specific resources to help a loved one, I would definitely recommend going to your particular state's page and seeing what it has to offer. And then the Become a Grassroots Advocate. So for those of you who want to be more involved in advocacy, I would visit this page. You can check out active campaigns and initiatives and write to your representatives. You can also connect with other advocates who are doing grassroots efforts in your area. So yeah, lots of good stuff here. And then the last non-AOT page I'd like to highlight is the Share Your Story page. And that's under Get Involved and then Share Your Story. This is for anyone who wants to write a personal blog based on their experience with severe mental illness. And these blogs are published by Treatment Advocacy Center under the Personally Speaking tab of our website, which you can find by going back to Get Involved and then clicking Personally Speaking. You'll find blogs there written by tax staff, family members, friends, those living with SMI. And it's really a great way to, share your story so that you can, and also remind others why this work is so important. And just reading the Personally Speaking blogs, I always find really inspirational. So I would definitely check it out. So back to the presentation. These pages, like I said, are a few that I've highlighted, but there is more to explore on the website beyond these pages. And there's more useful stuff that I haven't covered here. So I would definitely recommend going to the website and just kind of bopping around and seeing what you can find. So we're now at the moment that we've all been waiting for, or it may be just me, I've been waiting for, but I am introducing the AOT portal. You can think of the AOT portal as the AOT Learning Network 2.0. So what was previously limited to an email newsletter with events, news, program highlights, resources, and other information on AOT has now kind of extended into a free membership platform, somewhat separate from TAC's regular website. And why we did this, so we built the portal with our AOT Learning Network members in mind. We wanted to give you more ease of access to resources, events, and more all-in-one platform. And the original goal of the AOTLN was to create a virtual network to keep AOT stakeholders and their counterparts from across the country engaged and facilitate the sharing of resources, ideas, and common concerns about assisted outpatient treatment. And now that the network is almost 2,000 people strong, we really want to evolve into more of a learning community that can interact with and learn from learn from each other, which is what the portal seeks to accomplish. And this slide just has a screenshot of the portal dashboard. So we're going to get into it now. The portal itself is accessible from multiple places on TAC's website and most of the AOT pages. So for example, if I go to AOT portal login here at the very top of the page, I can get to it. I can also get to the portal by hovering over AOT and clicking AOT Learning Network portal here. Or here. So lots of places you can get to it. And then just a little bit about logging in. So This slide includes a screenshot of a text box from the portal login page. This is the only time I'm going to read directly off of a slide, but I just want to do that because it's very important. So if you currently receive our AOT Learning Network members, that means that you are already a member and you should log in to the portal with your email address and set a password. You do not need to register. If you're new to the network, if you don't get any of our emails, you would register for a free account. And I will show you how to do that. So we're going to this login page, which, as a reminder, you can navigate to from multiple places on tax websites. This is what it looks like. So for those of you who do receive our emails, what you would do is put the email address that you received those emails to in this login box, and you would click forgot your password or need to set a password. And then you would put your email here again and click get new password. Then you will be emailed an email that will have a link where you can set your password. And going forward, you would use your email address and password to log in. If you do not receive our emails already, then you're not a member of the AOT Learning Network yet, and you would need to register. So from the login page, which you can actually do from this page too, but I'll demonstrate it from here. There is a purple register button in the upper right-hand corner. You would click this button and then be redirected to a registration page where you would enter all of your identifying information and click register. And once you've logged in or created an account, I'm going to just log into my account in the AOT Learning Network portal. You'll have access to everything in the portal. And I want to remind everyone that this is a free learning community. We're not going to be charging you for anything in here. The only difference from what it was before is there's now the step to log in. And so this is what the portal looks like once you've logged in. You can see that this is my dashboard. I've got this top toolbar, and then if you scroll down, you kind of get to the highlights of, excuse me, the portal features. So we are going to start with the most exciting feature, which is the AOT resource library. So if you scroll down, you can click here to get to the resource library. You can also access it on this top toolbar. And we're just really excited to have all of our resources in a more navigable format. Just an overview of what's included. If you navigate to the resource type dropdown, you can see that all of our resources are categorized by type. We'll start with the AOT research reports and analyses. You would click search, and then you can see here that it's displaying results for that resource type. These include both TAC and non-TAC products. And unlike our old resource library, the new version has kind of short little blurbs explaining what each resource is, so that you can easily find what you need and not spend extra time opening documents just based on title. And then the library is also organized in such a way that you can see the path you took to get to a particular resource. So if I click this state and community considerations one, I can see here that my path was, I was on the homepage, I went to the resource library, and I got here, just so you don't get kind of lost within the portal. And once you open a particular resource, you scroll down and then you're given the button to download the resource. When you click download resource, sometimes it automatically will go to your downloads folder without doing any kind of pop-up. So in case you don't think that it actually successfully downloaded, make sure you check the downloads folder of your laptop or phone, as this should be mobile friendly too. And back to the resource library homepage, we are going to check out the next resource type, which is community education resources. These include anything you might use to educate community members on AOT broadly, as well as specific community education for specifics on a local program. So you can see that we have a bigger picture resources like the AOT outcome summary. I can click into that. And I'll just open it up to show you. Hopefully my screen will let you see it. But this is how you would go to your downloads folder. I'm not sure if you all can see this, but hopefully you can. So here we've got our research summary, which has AOT research highlights.
Hey, Brooke, it's a little delayed. We don't see it yet.
Thanks, Amy. No worries, you all can check it out on your own. And then in this community education resources section, we also have sample brochures from across kind of the nation. We've got one from Georgia, we've got one from Kansas, and these are all available on here for you to use. So please feel welcome to download them and edit them to make them your own. Definitely borrow anything you need. And then the next resource type I'm going to briefly go over is the data collection tools. In this section, you'll find resources to help you begin to collect program data. We've got a recorded presentation from TAC's former Director of Research and Public Affairs on why collecting data is so important to program evaluation, improvement, sustainability. So that's great if you want to know the why, or if you want to convince others we need to be collecting data from the very get-go. And then we've also got a data collection guide and a data collection spreadsheet that you can actually use to collect program data. And our Office of Research and Public Affairs is always happy to assist with data in any way you might need. Just reach out.
And if I can just pop in here, the cool thing about the spreadsheet is that it has now been adjusted so that you can get reports. It will do reports based on the data that you enter. So it's not just a spreadsheet. It will show you how things are going as well. So
that's awesome. Thank you, Amy. And then example policies, procedures, and forms. This is going to be the largest category of resources in the library. And we actually have, let me scroll down. Yeah, 10 pages of documentation from programs across the country. This is where we'll remind you not to reinvent the wheel when you're starting an AOT program, and borrow from communities already doing this work. So you could see we've got treatment plans from multiple places. We've got job descriptions for peers, court documentation like petitions, evaluations, all sorts of stuff. It kind of goes, really any kind of form or documentation you would need is in here, and we are constantly collecting more. So if you are working in an AOT program and you think you have, even if you don't think that they're good forms, we would love to have them because we want to make this, we want to really make it so that as you're working to start AOT, your focus is on collaboration and your stakeholders and not so much on paperwork. So please use these, and like with the other documents, as long as you remove the information that's specific to that state or jurisdiction, you can download these and make them your own. And then the implementation worksheets section. This has two of our worksheets, which are the building blocks and essential elements. Both are foundational resources on implementing AOT in your community, and walk you through step-by-step process on how to implement and then how to assess your program's incorporation of essential elements. And then the related topic research section is what it sounds like. It's research that may not necessarily reference AOT directly, but that is related topically. And then finally, the TAC templates section includes templates that our team has produced that are Word documents for you to edit depending on your own needs. So things like an initial stakeholder meeting agenda, eligibility criteria for AOT, what criteria should you consider beyond your state statute, a treatment plan template, things like that. These are great. And like I said, they're Word documents for easy editing. And then just returning to the resource library functionality, you've got a search bar, the resource type filter, which we went through, as well as a way to filter by state and county to further increase kind of the ease and efficiency of searching for resources. And keep in mind, you can select multiple filters at once for more specific searches. So for example, if I go to resource type and I select example policies, procedures, and forms, and then let's say I want to select Texas. I'm really favoriting Texas in this presentation. And then let's see, Travis County. If I do that and then I click search, it's going to give me the documents from Travis County, Texas. And I can see on the right-hand side what my filters are. So obviously we don't have documentation from every state and every county, since every state and every county doesn't have AOT. But like I said, please send us your forms. We would love to just continue to increase the usefulness and the impact that this resource library has. And you can email those to us at aot@treatmentadvocacycenter.org. So just returning to the portal homepage, if you scroll down past the resource library section, you can see this section, which says the AOT is a community. You've got this handy picture of our implementation team. And this contact us button will take you back to that contact us form. If you don't want to send an email, you can also send us a message through that. And then you can also access the AOTLN forum, which is a new feature we're really excited about. The forum will give you the opportunity to connect with other members, to share expertise, ideas, and ask for help. And by scrolling down, you can create a new topic. You can tag your topic, and you can also set this notification button so that you will receive emails if people reply to your topic. For example, if I click on Christine's post on sample treatment plans, I'm given the opportunity to reply. And then I can also set myself up to be notified again if anyone replies to my reply on the thread. And then if I scroll up, I can see that Christine tagged her post with sample and treatment plan. If I'm interested in future forum posts on those topics, those tags, I can click favorite, which I've actually already done here. But I could click favorite here to add them to my favorites. And then if I want to be emailed about future posts in this thread, I would click subscribe. And the forum is moderated by our team, but that doesn't mean that certain topics are off the table. We want this to be a useful tool. So as long as your forum posts are respectful and appropriate, we welcome candid discussion in there. And then back to the portal homepage, we're going to keep scrolling down past this section. And you've got another handy link to the AOT program locator, which we went over earlier. And then scrolling down, so we received feedback from AOTLN members that there should be a way to register for webinars and web chats on the website directly. And we did listen. So you see that there's this news and events section. If I click February's AOT Learning Network Bulletin, I'm taken back to TAC's website. And if I scroll down, it's probably going to take a minute to load. I am given a PDF of the email bulletin in case I've deleted it from my inbox or if I want to direct someone else to it. And it's got the registration links for the events in there. And the page will be updated with that month's bulletin each month. And then you can also visit the events subpage under Media Center. So if you go to Media Center here, and this top toolbar will always be here when you're on the regular TAC website, and you go down to events, you will have access to events that are happening now. The one for this webinar isn't showing up since we are here on it today, but you can see that our next web chat is listed here. And if you click into a specific event, you will get to the Zoom registration link. So you would click here to register. And as a reminder to everyone, you all probably are Learning Network members and you know this, but just to kind of remind you, we offer AOT-focused educational webinars every third Thursday of the month at 3 p.m. Eastern. And then we hold AOT stakeholder-specific web chats every fourth Thursday of the month at 3 p.m. Eastern. Webinars are presented by experts in the mental health field. And they always include the opportunity for audience Q&A. This past January, we hosted Melissa Maxey of the Center for Evidence-Based Practices at Case Western Reserve University for a webinar on stages of change in AOT programs, which was really great. And you can view that, the recording of that webinar, as well as a bunch of other past webinars, but I think at most of our webinars on our YouTube channel, which is going to be linked on the next slide. I mentioned the web chats are stakeholder specific. We hold them for AOT champions, clinicians, monitors, and judges. All of those chats are open to join except the judges chat, which is limited to members of the judiciary, like judges, magistrates, hearing officers, etc. And our next web chat is for AOT clinicians. And is happening next Thursday at 3 p.m. Eastern. And you can register either in the bulletin if you have it in your email or on the site by going to Media Center and then Events. And then finally, the portal has a couple of what I'm calling pending pages. I'm going to go back to the portal. And let's see here. So we do have some pages still in development. That's the National AOT Institute page, as well as if you scroll all the way to the bottom, the continuing education page. I won't say much about these because, like I said, they're still in development. But we are excited to hopefully offer continuing education credits for some of our events at a future date. And even though these pages are pending, you can still click into them and find out more. And if you're interested in hearing about the plan for the National AOT Institute, you would just click here and there would be more information about that there. And then finally, like most kind of login-based platforms, you can edit and update information about yourself in the account settings page, which you can get to via the drop-down under your name. So you hover over your name and then click account settings. And you can see your profile and then also change your password if you need to. And then I've included this slide just to highlight items that I haven't covered in the presentation elsewhere. First is our YouTube channel. Like I mentioned, you can click here to access it. You can also just search Treatment Advocacy Center on YouTube. That includes a bunch of presentations from our 2022 National Symposium that were recorded AOT Learning Network events. We've got informational videos on there, like one on anosognosia or lack of insight, AOT success stories with graduates sharing their experience, as well as other recorded chats. So we've got a lot of great stuff on YouTube. I definitely encourage you to check it out. And kind of like with anything we're showing you, if you're looking for a specific material to use in a training or share with your community and you can't find it on your own, you can email me and I will hopefully find it for you, because we do have a lot of resources, or point you in the right direction. And then next are the AOT microsite on SMI Advisor. So SMI Advisor is a product of the American Psychiatric Association. It's an open access mental health resource library for providers and others seeking information to help individuals with SMI. And linked here is the AOT microsite. We're going to go to it. And so the AOT microsite has a couple of useful items on it. Mainly the first thing would be the foundational resources. These are all like 1 to just a couple page long documents that provide basic information on AOT, like a what is, a terms glossary, myths and facts, comparing AOT to other tools like mental health court, a step-by-step process for participants that's pretty general. So those are really great materials to use in trainings, or if you're just introducing new folks to AOT and the concept. And then we also have our AOT learning modules. These, again, like everything I've introduced here, are totally free. And we've got, I think, 9 modules total. 8 are the main ones, and the first 3 are more general. The latter 5 are specifically for implementers and based off of our white paper document. And then there's a final module to orient peer support specialists on AOT. And these are great because social workers and doctors who complete them can get 3 continuing education credits. And again, they're free, so a good way to knock those out. And they are a really good way to orient new staff to AOT. So the only thing you have to do to access these is make a free account on SMI Advisor, which is you can do pretty easily. And then finally, I guess we did cover that, but the TAC events page is where you can register for our webinars and web chats. And we've also got other events on there from other departments. And that is it. Thank you all so much. I've got my email address on here. I've got the website again, and then the email to contact the whole team on here. Um, and I'm Brooke again, and happy to help you with any resource navigation or site stuff you might need. If you log in and you are encountering any kind of errors too, please reach out and let us know. Okay, so I'm
Alright.
gonna see,
Time for questions.
yeah, if we've got any questions.
So far, it's just kudos to Brooke.
Thank you, everyone.
And just to let you all know that we are also still getting used to our website. So there may be some bugs in it. And as Brooke said, if you find something that doesn't make sense, just let us know.
Yes. Yeah, we always want to be making improvements. And again, you know, the network, which is now the portal, is kind of only as good as its members, which you all are amazing. But I say that just to remind you that send us resources, send us documents so that they can help others in this work. And same thing with the program locator map. If you know of a program that's not on that that PDF document, let us know. I think that's it.
I think that's it.
Yeah. Thank you all. I know this was a little more technical than our usual webinars. So thanks for sitting through the demo, and everybody have a fantastic rest of the week.